Welcome to Riverside Talk. My name is Denise Mananis, and I am the Associate Vice President of External Affairs at St. John's Riverside Hospital. Today, we are hosting our program at the Gerard J. Burns Center in Ardsley, and we will be talking about optimizing our health with Dr. Howard Lux, who I will introduce in just a moment. But first, I would like to acknowledge our team, Nancy Anabi, who is our community liaison and who works with this center, Candace Cousins-Hopkins, who produces these events, Olivia Hunter and Jason Latore, who are our media production team, and we could not do any of this without them. I'd also like to acknowledge our original partners, the Yonkers Neighborhood Naturally Occurring Retirement Community, that is a mouthful, the Yonkers Public Library, and some of our newer partners, the Ashling Irish Community and Cultural Center, the Department of Veterans Services, City of Yonkers, Ardsley Senior Center, Bronxville Community Center, the City of Yonkers, Community Baptist Church, Greenberg Parks and Recreation, the Hastings Community Center, Irvington Community Center, Westchester Jewish Community Services, and Yonkers Pathways to Success. After the presentation, we will open up the conversation to the audience. For those of you who are watching on YouTube, please post your questions in the comments section, and we will do our best to answer them if they have not already been answered after the interview. And so now I would like to turn and introduce our speaker today, Dr. Howard Lux, who is an orthopedic surgeon. Dr. Lux is board-certified orthopedic surgeon dedicated to improving the lives of his patients through evidence-based, patient-centered care. Dr. Lux graduated from New York Medical College, completed his residency in orthopedic surgery, followed by a fellowship in sports medicine at the Hospital for Joint Diseases in New York City. He is currently practicing at the Westchester Orthopedic Center at our Dobbs Ferry Pavilion of St. John's. He's focused on the shoulder, knee, and elbow. With over 25 years in practice, Dr. Lux was able to utilize his insights as a physician to author Longevity Simplified, and that is his book, which offers a very unique perspective on metabolic health. Dr. Lux has been a contributor to GQ magazine and is frequently featured in publications like the New York Times and the Washington Post. He has been a guest on over 50 podcasts and co-hosts the weekly Simpla Vita podcast with Dr. Paul Kidrowski. We are thrilled that he can now add guest of Riverside Talk to his impressive resume.
Thank you.
Please join me in welcoming Dr. Howard Lux. Thank you for being with us.
Nice to be here.
Okay, so the first question is an obvious question. You're an orthopedic surgeon.
Right.
And you wrote a book about longevity.
I did.
So the leap between orthopedic surgeon and longevity, can you give me a little?
It's not very clear, right?
Yeah, how'd we get here?
I've been an athlete my whole life,
Okay.
lean and fit. And I had 3 kids in rapid succession. Wife did, but I had to help raise them. And I was a busy on-call surgeon. And so my activity schedule suffered dramatically and gained a little weight. And I saw a radiology buddy in the hall one day. I had some abdominal pain about 15 to 16 years ago. And he said, come on in, I'll do an ultrasound. And he did. And he said, oh, you're fine. You just have some fat in your liver. Like, what's that? So I started reading. And I've run one of the busiest orthopedic websites on the internet for about 15 years. And if I want to learn something, I write about it. So I read about fatty liver and what the implications were, and I wanted to learn more about it, so I wrote about it. I put that up on my website. And over the years, I added posts on diabetes and blood pressure, cholesterol, et cetera. And the traffic to those posts started to get even busier than my orthopedic posts. And eventually, a lot of people asked that I write a book. So it took a year. I did some more research and put it all together.
So
and
you're a
wrote Longevity
research guy,
Simplified.
is what
Correct.
you're telling me. Okay, and so there's a lot of people in the world who do research, and a lot of people don't know what to do with it. So I do think that you have a particular talent for bringing the research into something that mere mortals can digest. Right. Okay, so let's get into the talk. you talk beginning in this book about making and adhering to longevity goals. If anyone in our audience is like me, setting goals is not the problem. Staying the course, that's more the problem. So, okay, is that better? Okay, sure. So setting goals and adhering to goals are two different things. So let's start with the setting goals. What kind of goals are you talking about, and why are they important?
Right. So we confuse both longevity and the more important term, health span, right? I don't want to necessarily live longer if that means that I can't walk. I don't remember who I just spoke to. I have to go to doctor after doctor after doctor. Health span is putting quality into your years. How many years do you have left where you're still golfing or playing tennis or pickleball or being able to hang out with friends and other community members? And so I'd like to define my activity goals in terms of, everyone knows a longevity doctor named Peter Attia. He defined the decathlete. What do you want to do? What 10 activities do you want to do in your last decade? So is that lifting a 50-pound suitcase into the overhead bin on the airplane? Is it carrying mulch to your backyard because they're 40 pounds or 50 pounds? Is it bringing 2 or 3 bags in at a time from your car? If you want to be able to maintain and do these activities, you have to be able to train those activities. You're going to lose the ability to do the things that you do not train. Aging and the issues that arise with aging individuals, it's not pre-programmed. We don't lose the ability to squat and get off the floor just because we're older. We lose the ability to squat or get off the floor because we don't squat down and get off the floor. And so if we keep that focus in mind, if we have well-defined goals, the goal isn't just, let's say, to live longer, then they're easier to achieve because they have to be real.
But they're also not goals that seem somewhat out of touch with reality. They're not goals where, oh, I think I need to start running and I've never run, and now I want to run 5 miles a day or 5 miles 5 times a week because that's what will keep me going longer.
Right. People in general, they overly complicate their pursuit of longevity and what they think is important. The data and the research here is really clear. Even back in the 50s, they did studies that compared train conductors to their cohorts. And all they did was walk more. Yet they lived 4 or 5 years longer than their cohorts, even though they had the same other habits, whether it was drinking or smoking. Same thing with postmen in comparison to their friends. Wow. They lived longer. So people think that it's not worth pursuing an exercise schedule or movement schedule if I can't run or cycle 20 miles. And that's just not true.
So you're talking about very modest goals. You're talking about life goals of things that you're doing now that you can want to continue to do.
Correct. There are a lot of people where it's going to take some effort to get them moving. I start them on walking 30 minutes once a day or doing 5 chair squats. And a lot of them will see that that's easy, relatively so, for most people. And we can build on that. And this is all that's necessary. People have heard you need 10,000 steps a day. It's not true. That's not what the research shows.
Really?
The research shows that 6,000 to 8,000 steps a day is enough. 1 hour walk or a 3-mile walk is going to get almost all of you to that 6,000 steps. So achieving enough activity to have a meaningful impact on your chance to live a healthier and longer life is not difficult.
Interesting. So in reference to this, and I know this term is everywhere, metabolic health. What is it really?
Sure.
And how do we measure it, and how can we sort of bring it into our own thinking
Sure.
about our life?
Sure. All longevity influencers on social channels talk about metabolic health. The cornerstone, humans die of very predictable causes, right? Heart disease, type 2 diabetes, insulin resistance, fatty liver, et cetera. All of these have the same root cause. The root cause is poor mitochondrial function. The mitochondria is a little structure in each cell, and it produces energy, ATP, and it uses fuel. That fuel is sugar, fat, protein, et cetera. Your ability of the mitochondria to create fuel, create energy from the fuel, will vary depending on your health. That's why some people can run an ultramarathon after not eating, right? And that's why some are going to get hungry and tired if they walk two blocks. It has a lot to do with your underlying metabolic health and mitochondrial function. Now, what helps mitochondria function better? It's exercise. And don't misinterpret the term exercise. Movement and walking is exercise.
Okay.
So people who are walking 5, 6, 7, 8, 10,000 steps a day are metabolically healthier than those who aren't. And improving your metabolic health is going to improve all these disease processes, right? It's going to help bring your blood pressure lower. It's going to improve your cholesterol. It's going to decrease your risk of dementia. Upwards of 50% of cases of dementia are preventable.
Really?
Upwards of 50% of cases of dementia are due to poor energy management by the mitochondria in your brain.
Oh.
And this has to do with your level of physical fitness, because that will determine how well your mitochondria function.
All right. So for metabolic health, I mean, that was very clear. Americans, though, have very poor metabolic health. If you look at all of the reports in the media, what is it about the way we're living that has brought us into this situation?
Yeah. So the reports that you are alluding to are that only 15 to 18% of Americans achieve metabolic health. Right?
15 to 18?
15 to 18%.
Well, that's
right
sad.
now. It is sad.
It's sad.
Now, why? Again, we have a number of levers to pull in our pursuit of longevity, right? And you can't choose which one. You have to sort of take them all on. So it starts easy: sleeping well, right? Eating well, and we can get into what that means. Exercise. Exercise is the number one lever, because that's the only thing that's going to retrain your mitochondria and help them to function. So you can argue that eating well is going to affect your weight more, but if your mitochondria aren't functioning well, it's not going to matter.
Right.
And then we have to be able to have friends and socialize, and we need a sense of purpose. I took my daughter to Greece at the end of last summer. She was going to school there, and we stayed at a little boutique hotel on the Mediterranean, 6 stories tall. In the center of the hotel, right past the front desk, was a stairway, an open stairway, going from top to bottom. In the back, hidden, was the elevator. And nobody took the elevator.
Interesting.
So it didn't matter what people's age or anything else.
They all
We have
walked
designed mobility out of our environment, right? And when I go down to Florida to visit my parents, it's golf carts everywhere.
Yeah.
Or someone parks your car for you and they walk you into somewhere. We have engineered that need to move out of our environment, and it's a significant problem.
Wow.
If you look at a lot of European countries and you look at a lot of the main thoroughfares, they're closed for bicycles. You see a lot more bikes chained up on the road than you do here, and that's a significant problem.
All right. So as Americans, you're saying we're sedentary, we've taken mobility out. diet and American diet and the food have become very big in the news recently about what's in our food. So all of these things do play a role, but what about pharmaceuticals? Do they play a role? People are prescribed blood pressure medicines, cholesterol medicines, all kinds of other things that they're taking for diabetes. We're now in the midst of an Ozempic craze. Do all of these things impact metabolic health as well as the other things?
So there are no medications that will improve your metabolic health except the injectable GLP-1 medication.
Which is the Ozempic or the whatever the other names of them are.
Correct.
So it will improve it because it helps someone lose weight.
No, actually, it has a lot of effects in the body, many of which we don't fully understand. So it'll improve someone's metabolic health before they start to lose a lot of weight. We get blasted, we as physicians, on, in media. Sure, you're pushing medications, because you're paid for it. I've never been paid a penny in 25 years for writing any prescription. And because we don't push lifestyle changes, that's not true. I've discussed that in every single visit in my office. And so we can discuss lifestyle changes, but also physicians are pressed for time now, because they're paid less and less and less. And it's an issue. So if you have 8 minutes to talk to someone and 10 things to cover, you can't really have the in-depth talk that is needed to get someone on the path to fitness. So medications are needed for many people, and that's why people are living longer. But that's why I talk about longevity versus health span. We can get someone's blood pressure down, which is going to decrease the risk of heart attack and dementia and stroke, but they're still overweight, they still have a fatty liver, their inflammatory levels are still high, their joints hurt, their muscles hurt, they're not moving a lot. So the quality of life in those latter years suffer.
That's very interesting. I want to go back to the dementia a little bit because you made a very startling statement. 50% of dementia is preventable. So explain that, please. I'm a little concerned.
Yeah, sure.
I'm forgetting things. I can't remember. I'm too busy. I blame it on my busy life. But I have that word. Where is that word?
Sure. So look, there are a lot of normal changes that occur with aging, right? I'm not as fast as I used to be. I can't go as long as I used to in the gym, etc. I have the same memory issues. So mild declines are normal, and they are associated with aging. And aging is basically inflammation or inflammaging, you may read about soon, and it's the impact of inflammation on our cells, our mitochondria, etc. But there are many causes of dementia. Some are genetic, but most are energy. So if your brain is using 25% of the energy or food that you take in, 25% of your daily energy demands goes to your brain. All right, so we need to get that energy to the brain. How does it get there? The blood vessels. What is atherosclerosis? Right? Heart disease is the number one killer of human beings today, even though it shouldn't be, because we have the medications and means to deal with it. So if we have narrowing of the arteries in our heart, we have narrowing of our arteries everywhere. And so the small arteries in the brain are narrowed. You can't deliver the food. The mitochondria in the brain, which process the energy or take in the energy to create the power or the ATP, they can't do it well because they're not functioning well. They're sluggish. It's like an old battery in a car. You have to turn it over a few times, before the motor starts, as opposed to a new battery. It just starts. That's an aging mitochondria or a sick mitochondria that can be fixed with exercise versus one that's functioning well.
So you're coming back to the exercise a lot.
exercise is the only means of addressing all the issues that, not all the issues, most of the issues that lead to poor metabolic health and threaten our healthy longevity.
Okay, and again, though, you're talking about movement rather than I got to go to the gym 4 times a week
Correct.
and lift weights and do things I
Correct.
clearly don't want to
Correct.
do.
I love going for a run and sweating. I love going to the gym and sweating. Most people don't, right? This is an evolutionary issue because we did not evolve to exercise as human beings.
Clearly.
Right? We've evolved over millennia, and what we had to do was move to get food, move to procreate, and move to create shelter. But after that, our body said, you know what?
You to rest.
You better save the food that you just had because you don't know when you're going to eat again. So we were designed or engineered during times when food was not plentiful. You didn't just have to walk 10 feet to your refrigerator. You didn't know what the next day brought. And there were seasons, and there was seasons when there was no food available. And then there were seasons when there was a lot of food available. So our body was engineered not to push us unless we were in search of food because we had to save that energy.
That's very
So
interesting.
we have brought those evolutionary traits through to today. You know, we still have ancient DNA inside us. And so it's only a small percentage of people who actually get an enjoyment or a rush to exercise. So that's why I make it very clear to people. Exercise is a broad term. If you leave here, walk around the parking lot 8 times as a group, slowly and talking, you just exercised.
That's interesting.
You don't have to drop and give me 10 push-ups. That's not what I'm talking
Thank
about.
God.
But you do need to move more.
Okay.
It works if you move more and often. So if you're going to walk an hour, split it into two 30-minute walks. I'd rather you do that than walk once in the morning and then go sit for 8 hours on the couch. The key is to always be doing something.
So,
if you look at the civilizations that are living longer, the quote-unquote blue zones, even though a lot of research shows that they might not be as blue as you think, what the cultures share in common, large families, lots of community, lots of talk, lots of gathering around food, lots of outdoor walking, farming, etc. So they're not jogging through the hills. They're not dropping and doing push-ups on the street. They're just far more active.
very interesting. All right, I want to turn the conversation to sleep, which is a kind of a national epidemic problem that Americans have. I don't know about the other countries in the world, but what is quality sleep versus length of sleep versus all of the things that we now know about the sleep problems that people have, like sleep apnea and some other things? Sleep, and sleep.
Sleep is a challenge for a lot of people. Sleep is really important. There are no organisms that do not sleep and do not need sleep.
Really?
There's no system in our body that fails to function well if we did not sleep. Your cognition will drop by 25%.
Yeah.
You'll fail a test if you didn't sleep well, whereas you would have aced it if you did. Your ability to drive, to think, your risk of a heart attack
To drive, oh boy.
goes up if you didn't sleep well. If you're diabetic, you might notice that your blood sugar is higher.
If you don't sleep.
If you don't sleep well. So prioritizing sleep is important. To a large degree, we don't prioritize sleep. Our brain wants to go to sleep at the same time and wake up at the same time.
So we're talking about
Each
being
and
on a
every day.
schedule and whatever that schedule works. I know I have half my household goes to sleep early, sometimes ridiculously early, and the other half is up half the night, but then they sleep late. What,
There are different chronotypes.
Okay.
So
what's a chronotype?
there, you know, if you're a night owl
Okay.
or a morning person, that's your chronotype.
Okay.
And you can't fight that. But it's important that it's the same time, and you need to optimize your daily schedule so that you get to sleep at that time. So for me, 9:30 or 10 o'clock. And I'm going to do everything I can to make my sleep better. So I'm not going to exercise late. I want food out of my stomach. If you have food in your stomach, you're not going to sleep well. So I'm eating 3 hours prior to
Okay.
bedtime. You and I
So you're
have
done at
you and
6 or
I have
6:30.
been at night meetings
Yes,
together
we have.
where I've left without eating because they've gone late. So
But you
that's
have much more discipline than I.
but that's the reason.
Okay.
Drinking, right? We all think that drinking puts us to sleep, but
Yeah,
it doesn't.
No, it
right?
doesn't. It elevates your heart rate, doesn't
Your
it?
brain
Yeah.
is incredibly active at night. It's going through all these cycles, and it goes through 5 of these sets of cycles. It has to process the memories of the day, and it has to wash out all the garbage from all the activity. Alcohol suppresses your brain function, so it's knocking you out. It's not putting you to sleep, and you will not go through those cycles
Very
at
interesting.
night. So you may pass out and stay asleep in bed for 7 hours, but when you wake up in the morning, you don't feel good because your brain did not go through the cycles
Which is
that
the
are needed.
REM sleep and the light sleep and
Correct.
the deep sleep, and they're all different.
Correct. So I won't eat for 3 hours prior to going to sleep. I'm not going to drink. I'm going to dim the lights in the house. Your brain is going to release hormones to get ready for sleep, and those hormones are not coming out if it's bright in your house.
So let's just stop for a second on that, because everyone is addicted to their phones, and I get in bed and I finished work, the computers, the screen, so the TV's on in another room, I'm looking at a screen, the phone is in my hand perpetually. When do I need to put that phone down before I go to sleep? What's the time?
An hour.
An hour. So the eyes should not be looking at a screen and the light that is emitted by those things an hour before.
Correct.
Okay.
These new LED lights
Are terrible.
are terrible for this. So I have an
Interesting.
incandescent reading light.
Okay.
It gets hot, so I burn myself. But it's a trade-off. But it's very low, so it's easy to read by. But these bright lights are hard, and they will suppress the hormones that we need to go to sleep.
Oh, that's really interesting. Okay. I've never actually heard anyone talk, and we've had talks about sleep and sleep apnea, and we're not going to get into all of those for this program, but the whole thing so far that I'm hearing is that schedule and routine and setting things up to respect what is natural to you
Correct.
is really key in this.
Yes, let me just add,
yeah.
sleep for a lot of Americans is a passive process. I'll fall asleep when I fall asleep. I'm going to stay up until I'm just exhausted.
Okay.
It can't be. It needs to be an active process. It needs to be, I'm going to sleep.
Oh,
I'm going to really try here, 9:30, 10 o'clock. And this is how I'm going to adjust the end of my day to accommodate that.
Right.
Of course, there's going to be, you're going to go out, et cetera. But you can set yourself up
For success.
for success.
Yeah.
And if you get into bed, your mind's racing, try box breathing. Box breathing is 4 seconds in, hold 4 seconds, 4 seconds out, hold 4 seconds, 4 seconds in. And just the counting and the deep breathing, you won't be able to think of whatever it is you're thinking of.
Okay, that's
It'll
good.
put you to sleep.
It's not counting sheep, but it's definitely counting.
You can count four at a
Four
time.
sheep and, okay. All right, let's talk a little bit about nutrition, because We live in a very confusing time where we get messages that change almost daily in the media on what we should be doing, what is appropriate, what's in our food. Can you give us some simple things to follow that make sense, that are not, I am not going home from work and cooking. So that's already on the table. And then there are women and men who have worked their whole lives and who are retired and love to cook, and they love to do that. I'm not going to be one of those. So cooking is an issue for a lot of people, so everybody takes a shortcut. So help us figure out how to do nutrition.
It depends on the shortcut you take, right?
Well, yeah.
So, nutrition is far too complicated, and today, you need to follow the money, right? Because a lot of people who are screaming at you online have a reason to scream, and there's a business that's behind them. But it boils down to, if you stay in the outer aisle of the supermarket, you're okay. Right?
The outer aisles.
The outer aisle.
So produce,
Because you're going to
meat,
go buy the vegetables and the fruits. You're going to circle around to the fish and the meat, and that's great. And all the box junk is in no man's land. We all have challenges in terms of finding time. My habit is I have a supermarket on the way home. The fish guy knows me. He said, "What do you want today?" Whatever. He gives me a pound of whatever that is. Boom, I grab a vegetable and I go home, and that's cooked.
So you're doing that fresh every day.
So, but it's something, but it's quick. I mean, it's 15, 20 minutes, to broil a piece of fish. I'll throw a steak on the grill too. I'm not against red meat. Red meat is not healthy for you if you put it up against vegetables, or plant-based meats or fish. In every study, you can twist the literature to convince yourself of anything, but saturated fat, cholesterol, it does cause heart disease. It's still the number one cause of death, and it shouldn't be. But we all have times that really break our strategy, like the morning, right? Donuts, Dunkin' Donuts, or any donuts. You can grab a yogurt. You don't need to grab a donut or a bagel, right? It's the ultra-processed foods
that are the problem.
Anything that's in a box, or with labels that you don't understand. And at night, right? What do we snack on? That's the challenge.
That's the problem.
We eat and we feel great, but then we sit on the couch, look at that kitchen, and we walk in there. What do you grab?
The sweet, the salty.
Right. So my answer for that, because I'm not any different than you. You put a bag of chocolate chip cookies with a pint of ice cream in front of me, they're all gone. I will not stop.
That's
right?
really great. Yeah.
So my answer is they're not in the house.
Right.
It's that simple, right?
Yeah.
I have snacks that are there,
But fruit at night. So fruit's a healthy option, but fruit at night is not great because it elevates your sugar.
3 hours before bed.
3 hours. But so what are we snacking on? Give me a snack, doctor.
So if I want a snack, I get up and walk. I'm not going to snack.
Wow.
I'm not going to snack for 3 hours.
I'm feeling a way about that, doctor. Okay. All right. Well, we'll come back to that.
But I'll do a pint of ice cream a few hours before.
Oh my God! But see, you're in great shape. Okay. All right. We talked a little bit about exercise and movement, but I do want to talk about movement in relationship to people of a certain age. Anybody who has osteoporosis, anybody who has some kind of joint issue. This is right up your alley, doctor.
Sure.
I mean, at what point does a person need to go and be cleared to start walking again, both from a metabolic health issue versus an orthopedic issue or an osteoporosis issue? How do you know it's safe? I'm motivated. I'll start walking more. I'm already trying to do that, but I also don't want to break something, hurt something. I don't want my knees to go away.
Yeah. So very few people are going to partake in activities where they need my approval, right? So I wouldn't suggest that an 80-year-old with osteoporosis start rock climbing, but you don't need my permission to start walking
Okay.
or to go to the gym and lift light weights. People get the risk equation around aging all wrong. Exercise is the risk you take to avoid the consequences of being still. The injuries, risk associated with exercise, activity, walking, lightweight training is exceptionally low. The risks of sedentary lifestyles are exceptionally high.
Okay.
You will not, is the risk of osteoarthritis in a runner higher or lower than the general population? It's lower. It's much lower. Half of y'all think that running destroys knees and hips. It doesn't. It strengthens bones and ligaments and tendons. It's a stimulus to the cartilage or the cushioning in our joints to regenerate. We have regenerative processes in our joints and tendons that don't turn on unless we're pushing them. So if we're sedentary or still, we're not going to heal something. So movement, in many respects, heals. Exercise, such as walking, has been proven over and over to be one of the best things that we can do with arthritic joints to feel better.
So that makes arthritic joints feel better because I know a lot of people present to you and their cartilage is gone. They've got bone on bone in their knees, or their ankles are in terrible pain, or their hips are giving them a problem. So,
Sure. There comes a point when your arthritis is severe enough that you can't do these things.
All right, wait. What's arthritis? Let's really define what that is.
So osteoarthritis, between the bones of our joints, we have cartilage. It's a cushion. It's a cushioning, and it's glistening and smooth, so we can bend our joints without pain. If the cartilage thins and gets thinner and thinner and is eventually gone, that is osteoarthritis. Thinning cartilage. That's it. That's the definition.
So what causes the thinning?
So there is a genetic component.
Okay.
There's an old injury component.
Okay.
And metabolic health. So cartilage is exposed to the same substances that are in your blood. If you have any metabolic disease, fatty liver, type 2 diabetes, etc., you have all these inflammatory mediators flowing around in your blood. They get into the joint and the cartilage is exposed to them too. So metabolic disease-associated osteoarthritis is rising in terms of prevalence. And how do we prevent that? Movement, right? And even people who are bone on bone. I have people who are bone on bone in their knees or hips, and I've not replaced their joints because they're still out there walking. You don't treat an x-ray, you treat a person. Because I have people who have mild arthritis on an x-ray, but they're miserable. Their joints are swollen. Everything that we've tried isn't working. We've injected everything. We've tried every medication. They need a joint replacement. I have people who are bone on bone. They're playing pickleball every day. And they take some Tylenol and feel okay. They don't need a joint replacement. So the x-ray is only part of the equation.
Right.
And so if you can move, you move. You're not going to make arthritis worse by running and moving. You're going to keep your joints longer the fitter you are.
Okay, so movement, and movement. All right.
Correct.
I got that. Okay, so we talked about movement, exercise, and metabolic health. But what is true fitness from a cardiovascular point of view? I mean, how I'm moving, I'm doing that, I still have a low cardiovascular profile. So I don't know how to impact that and improve that.
Sure.
Even though I'm sleeping and trying to obey my chronotype and I'm doing all the things I'm supposed to do and increasing my steps. How do you get to that fitness place?
That's VO2 max. Your VO2 max is the maximum amount of oxygen that your muscles can use per minute, right?
Okay.
That number goes down every decade. If you're sedentary, it goes down
Faster.
twice as fast. After 60, it goes down 3 times as fast. However, in people who exercise, it still goes down, but not nearly as much. No matter what, no matter how old we are, we will create new muscle protein if we work out, even in a 90-year-old. I don't care how old you are, you can increase your VO2 max, your ability to use oxygen, your fitness level, if you challenge your body. If you challenge it and you increase that load and ask your body to adapt, but you do this wisely, you can't leave here all excited and go run 10 miles. You're going to break, right? But you can leave here and go walk for 30 minutes. And in a week and a half, walk for 40 minutes. And in 3 weeks, walk for an hour.
Okay.
And then an hour and 15 minutes. And then you want to jog for 10 seconds and walk for 50, jog for 30 and walk for 30.
All right, let's talk about the walking.
But all of these, this is progressive loading.
Okay.
And this is how you're going
Improve
to
the fitness.
improve your adaptation to this loading and thus improve your fitness.
Okay. So we talked a lot about walking. A lot of people don't love to walk. What are the kinds of things that are basic to life that you could recommend
Sure.
that would be?
Cycling works, swimming pool works,
Oh, swimming.
tennis has some of the best research with regard to its impact on longevity.
Really?
Why? Right? Pickleball counts too, because the loss of social connection and loneliness is a huge killer of people. Being lonely is an awful problem today. So what does tennis accomplish? Not only are you getting outside and running
with
around,
someone.
you're with 3 friends. And not only that, but you're going to sit and talk afterwards. And not only that, you might go out to dinner. So you're getting a lot of bang for your buck. So I'm not telling you to go run. Walking is one example. You can tell by my emphasis, the emphasis is movement. It's getting your body to do the things that it was born to do.
But I do love that social aspect. I think we all get lost in our screens and in our problems and, you know, all of the challenges that people have in the modern world, and we do pull away from each other, and it is harder, and so that impacts.
Correct. With all the technology available and our means of travel, our worlds have narrowed.
Yeah.
Right? People don't read books anymore. They don't have the attention span to read.
Right.
They don't call their friends and talk to them. They don't go and visit them. They text them. You know, you don't text your mom happy birthday. Come on. I mean, right?
Some people don't.
But I know, but we are suffering a lot from the loss of many of the aspects of our life that used to make us human, and the social connection is a very strong one.
Very interesting. All right, I would like to open the questions up before we finish today to our audience, and so if there's anyone here who has a question, yeah, sir.
I have about 3.
Okay, let's do number 1.
Number 1
Yeah.
is weight. Does weight have an effect on the telomeres
Weight has an effect on, for the large majority of people, weight will affect your metabolic health, yes. However, there are people who are heavy and large that are metabolically healthy and fit. It depends on if they exercise, right? And also depends on where you carry that weight. So people with thin legs and a belly, not healthy, because that's visceral fat. Fat that's around the organs on the inside is not healthy. Fat here, it's actually healthy. It's actually protective. That's where we should store it. It's the visceral fat that we worry about.
Okay.
Second question?
Yes.
for me. My cardiologist told me that I had to do more cardio. All right? And I had been doing floor exercises, push-ups, sit-ups, and I said, that's not cardio? He said, no, I want you walking. So I think...
He's right.
Yeah.
Yeah.
That's not cardio.
And I wondered why. Because I was exercising, I was moving.
getting your heart rate up, it isn't cardio. It's this repetitive movement that's done for a prolonged period of time, and it's constant. So, you don't have to get your heart rate up to 130 or 140. 110 is fine. You don't have to. If you want to sweat, great. If you don't want to, that's fine. It works.
Interesting. Third, one more.
I'll let someone else in.
Okay, yes.
What happens if you want to do all the exercise, you want to walk and try, but your underlying condition prevents you? If you have severe degenerative disease or severe stenosis and you're told, well, the only way you'd be able to even walk that is to consider surgery, but you don't want to have surgery.
Okay, let me repeat the question for our people at home. So the question is, what if you've been given a diagnosis of stenosis, you have stenosis, and that you've been told that you want to walk, but that you really can't, or you don't feel that you can because of that diagnosis?
And you can walk, but you get very tired very easily.
Yeah.
Due to the condition.
So what do you
try to
do?
maintain it as best as you can. But I don't want to, if, let's say a person doesn't want to have surgery, because whatever outcomes you do see from people around you, it's not a good result.
Sure. So I can't address spinal stenosis in particular, but in general, I see a lot of people in my office who were told, oh, you have severe arthritis, you shouldn't walk anymore. So that's just bad information. I've seen people who've been told you have severe spinal arthritis, you shouldn't walk anymore. Oftentimes, it's not us who determines if you should walk more, it's you, can you, right? Again, I can't speak to your specific case, but a lot of times we overestimate the risk of harm by doing something as opposed to underestimating the risk of what happens if we don't do it. Because you're noticing that your cardiorespiratory fitness level, because you get tired, is dropping, right? So then what about if you walk in a pool, right? What about if you sit on a bicycle, a stationary bicycle? These are all ways of getting some degree of aerobic fitness in. And, a lot of people are afraid of surgery. No one wants it. Sometimes it comes a time when we have to think about it because we see our world narrowing so much and we lose the ability to do so many things that we're faced with a tough choice. And for many people, if they wait too long, they get very depressed. They have no fight left in them. They're not going to recover from an operation, and now they shouldn't have it. So,
when I exercise, when I'm walking, if I have pain in my knee or hips, they say stop.
who's they?
Continue. Is that, which one is better? Keep doing it or stop?
Who's they? They say stop. Who's they?
I mean, I read it. Also,
Right. So,
listen to YouTube.
yeah. So,
Yes, so let me repeat the question so that if you're walking and you have pain, the advice that has been given is to stop.
Stop or continue.
Is that a correct advice?
Which one is better? I mean, what should I do? Stop until get better or continue walking?
you know what I'm going to say. So in general, a lot of us are going to have aches and pains, right? I haven't had a pain-free run in 10 years, something like that. But I know when a pain is, oh, you better chill out. And another pain is also, okay, here we are again. So most discomfort you can walk through, all right? Something that's new, something that's sharp, something that if you're not sure, that's why we're here, right? I'm not in the office just to operate on people. 98% of people who come to see him in the office don't leave with a scheduled surgery date.
That's true.
Right? We just have a discussion, right? Alleviate your fear so that you're comfortable in walking with pain. Also, if you can walk and have a normal gait, a normal cadence, and a normal stride, keep going. If you're limping and you're hobbling and you have to stop every 20 feet, no. You got to find something.
Can I just ask a question before we get to this lady? I know you had your hand up. Pain medications. people do start taking them because they want to make that pain go away. What pain medications are okay, and how often is too often to be taking them?
Yeah, so, right. Anti-inflammatories in general, so Advil, Aleve, Celebrex, etc., do not take them prior to exercise because you think that's going to prevent the pain, right? Because they have a lot of effects on blood flow, on kidneys, and those effects are potentiated during the exercise, right?
Oh.
So if you're going to take it, you're going to take it afterwards. You don't need to take them unless the pain is severe. You're not changing anything. You're not making the arthritis better. It's not going to make it go away. So if you get home and you're really uncomfortable, you can't sit still, take something, preferably Tylenol, if not an anti-inflammatory. But only if needed, only as much as needed. It's not curing anything.
Okay. And this lady back here?
Yeah, I don't know, Dr. Lutz, if I look familiar to you, but I was a patient quite a few years ago, and I'm bone on my left hand. When you said there were patients that come to me with bone on bone and they could do pretty much anything, I'm one of those people. It was painful, and you gave me some injections, and they lasted a while, but I'm at the gym 6 days a week, and I push through it, and people are amazed when I send them bone on bone. They say, no, you're not bone on bone. I said, I am, but I do squats, I do Zumba, I do strength training,
Wow.
I do it all. And I remember what Dr. Lutz said to me. He said, a little pain, we all have little pains. You just get through it and you continue, and there was an article, I think, in the New York Times just a month or so ago about pushing through, like, it's not going to hurt you. It's only going to build you up more by continuing doing that exercise. And I'm not a plant, and
I swear, we did not pay her.
but it's exactly true. It really, and I continue, and this is years ago I came
Wow.
to you, and I'm fine.
That's
I'm fine.
great.
It hasn't really gotten any worse, and if anything, it's gotten a
Better.
bit better. Yeah.
That's great. Wait. Let's go back to this lady, and then I'll get you.
I'm sorry to be redundant, but would you have the same effects by going on a stationary bike for 30 minutes as you would if you walked?
You have, in terms of your heart health, yes. In terms of bone density and other things, no.
Because it's not weight bearing.
Correct.
Yeah.
But
Okay.
listen, but it's better than nothing, right?
Right.
I mean, I'm the type of person, if I have 20 minutes because someone canceled in the office, I'm walking around the block because I know it's 14 minutes for me to do that. If I have lunch, so every minute that you can is really important to do.
All right. This lady?
What does it mean to have a slow metabolism?
What does it mean to have a slow metabolism?
People don't have slow metabolism.
Thank God.
They really don't. A lot of weight gain it's caloric excess. That's it, right? It's
Oh.
not. Yes, if you eat more ultra-processed foods, you're going to gain weight gram per gram with the ultra-processed foods, but it's not because it's slowing
The metabolism
your
down.
metabolism
Yeah.
down. We all have the same ability to generate a metabolism. So we have different caloric needs because of our underlying physical activity, right? So I need about 4,000 calories a day because of everything that I do. You might only need 1,800. So you have lower caloric demands, not a slower metabolism,
Interesting.
right?
Okay.
Does it change like as you age?
Yeah, because we move less, we do less, we challenge ourselves less. So we don't need the same amount of energy to sustain us.
Okay. This lady here.
Yeah.
Yeah.
So what happens in the situation that I'm in complete pain all the time, my back goes down my leg, my knees and everything. According to the doctor, I have stenosis. I have what you mentioned, spinal arthritis. And I'm going through all that, all the medications, but nothing works. Still in pain. And I walk, I do exercise, I do everything that I can, and still. And I'm not going to go through surgery, definitely not.
Right. This is the reality, of what we deal with. We will not be able to help everyone. There are going to be people who meet in my office who are going to feel great if they adopt an active lifestyle, and there are those that may not.
So Dr. Lux, can I just bring up, there's a whole new field of pain
Yeah,
medicine.
I was going to
Go there.
So-
Management right now, and still the same.
Maybe not the right one, I'm just gonna say. We'll talk. We'll talk after.
You mentioned visceral fat is bad one. How do I know?
You don't have any visceral fat. So you,
How did I check?
those are, so it's called a DEXA scan. So you can get a DEXA scan, DEXA, and it'll scan you, it'll tell you what amount of your body is lean mass, what is fat mass, and what your visceral fat levels are.
Thank you.
Yeah. Any other questions?
Is that different than the one for bone density?
Same machine, just change the dials a little. Yes.
Yeah. Lady in the back, wait. Back there.
Question on stem cell, does that help the knee also?
Save your money.
What about stem cells?
So, all right, so
Stem cells is the question, does that help knees?
So there is some research that platelet-rich plasma, not stem cells, will improve pain. All right. There is zero research that shows that stem cells and PRP will regenerate cartilage. So if you're in horrible pain, you've tried everything else, and now you're going to spend $5,000 to avoid a knee replacement, you're going to spend the $5,000 and still have the knee replacement, because it's not going to regrow anything. It's a useful adjuvant in people with mild to moderate pain, but they're still active. They just want to be a little more comfortable. In those situations, the PRP injections are useful. But all PRP is not created equal. There's many different systems out there. There's a lot of junk systems that are out there. So you need to know a lot about it before you sign up for it.
The
Wait,
is approved by FDA?
Which therapy?
You just mentioned protocol.
No, PRP therapy.
Yeah,
It is approved.
yeah. Can this lady right here, yeah, has been patient.
What is the highest age that you've performed knee surgery?
94.
Really? Is there a maximum that you?
No,
cannot
because
perform?
age is a relative factor, right? Because I see 60-year-olds in my office who can't get off a chair, they're on 20 medications, and they're about a week away from the end of their life. And I see 95-year-olds who are in my running group. They run through Rockefeller Park. They don't run as fast, but they're out there running. This oldest gentleman was 94. He came to me in a wheelchair. He was pissed off at his family because they stuck him in a wheelchair and stuck him in a home. The only thing he wanted to do was garden. I told him, you give me a year, I'll give you your life back. So I did one knee. About a few months later, I did the other. And for 7 years, I got delivered a bushel of tomatoes every August.
I love that story.
When do you actually know when you are ready?
You will know when it's time to have a knee replacement.
It's enough.
No, you don't wait until you can't walk anymore. A life of arthritis is a life where your world is narrowing, right? You start to stack things at the bottom stair. You start to use the supermarket cart as a walker. You don't, you yell at your husband because he parked too far away from the restaurant. When you start to see that the arthritis is really starting to impact your quality of life, now you have a decision to make, because as I mentioned here, recovery from a knee replacement is hard, right? It requires a lot of effort. I need to do my part, but you have more work to do. And so you have to have a little spunk left. You have to have a little fight left. So if you get so beaten down and so depressed and so lonely that you don't have any fight left, you're going to be worse from the surgery. So once you've noticed that your world has started to narrow enough, you have to have a talk with yourself and say, I think it's time.
This lady first and then you.
Would the PRP help a torn rotator cuff when you can still like move, but you're feeling pain? Like not severe pain?
So the
but you know it's
PRP isn't going to heal a rotator cuff tear. Platelet-rich plasma. It's where we take your blood, spin in the centrifuge, and take a part out and inject it back into you.
Before we
It
continue,
won't cure the.
we're not
tear.
going to cut off your questions, but I do need to end our program, which is live. So I would like to thank our online audience and this audience for being with us today. We hope that you will join us again. We have more of these great programs coming up. Thank you very much.